Hi, my name is Casey Burns. I'm the Executive Director of the Coalition for Healthy Greater Worcester,
I am Chantel, the Community Engagement Coordinator.
and we are coming to you from Worcester, Massachusetts, and we're excited to talk to you about our project. Um, we're a health equity coalition, and so talk a lot about root causes and health outcomes. But one of the questions we had in our community was really how do we best visualize and explain what the root causes to food security is, so we could, also resource some of those upstream drivers. And so this is Worcester. We were able to kind of capture some of the strength of our community here. And we were able to pose the question that if food insecurity could be fixed by food, then we could just have more food pantries, we could give people food, we could provide free food, and it would be fixed. However, what we find is it's much more complicated. Those are temporary solutions that may impact individuals, but we still see disparities on a population level. And that is because of inequities in our systems that are driving really the foundations of the way people live. And that includes healthcare and transportation and job access and education and all of those things. And so we want to address those things, but we find that because there are so many assumptions around food security, it can be really difficult in order to kind of reinvest in ways that are really meaningful. And so we engaged with this project.
And what we did is we enlisted 11 stakeholders that were residents and professionals to come to the table to have this conversation. We wanted to hear from the community because the community is who we're looking to help and assist. So we needed to hear from them to see what their concerns were. A lot of those things were transportation, healthcare, job security, those that are on benefits, trying to get ahead, but they're not able to because if they work more hours, they lose all of their benefits.
And so what we found through this process and using the causal loop diagram was that there were two major pivot points. There was balancing households' costs and the demands on people's time. And we were able to show that through this process. And so what we found is that, money in the household is impacted by spending on childcare, on housing, on medical deals, and that directly impacts the amount of money you have available for food. We're able to uplift voices in our community in order to tell their stories and what that means for them. And we were able to show how this connects to, then contributions to health outcomes and how that can then impact your ability to earn more income to provide for that centralized resource. We were also able, I'm just going to skip ahead, but there's lots more here. We were also able to kind of focus in on this concept of time, because what we heard from our community partners and our stakeholders in our process was that you may have the resources, but if you don't have the time to plan, shop, prepare foods, then it still won't make a difference and you're still going to face those hardships. So we talked about how the time people have is impacted by their living conditions. If you're taking the bus, if you have more than one job, if you have mental health challenges and complicated medical conditions, that impacts the amount of time you have in the day. And so with this process, we were really excited to be able to, bring this together in a new way to visualize it. These were instincts and things that we knew existed in our community, but we weren't able to tell the story in a comprehensive way. And we weren't able to really analyze where the opportunities for pivot points for collaborative work was. So we're now able to direct people to one of our many partner organizations working on these kind of core concepts of living conditions. And we are so grateful to all of our stakeholders who participated into this process, who shared their vulnerability, their stories, their ideas with us, and we're excited to take it to the next level.
Thank you all
Thank you
so
so
much.
much.